Greetings. So this is the first global conference and official launch of Canada Afrique-Care Foundation. We are under the theme Building the Future with Canada and Africa. It is more than a great privilege to have with me here Dr. John Sampson, Mr. Tamba, and Mrs. To. So we are going to have a very interactive session. But first of all, we would like to know who we have on the line. To begin with, my name is Charity Kesewa Frimpong. I'm the host for this interview. We begin with Dr. John Sampson. I actually know you to be such a great pioneer of community development in Africa in terms of healthcare, doing a whole lot for Africa and so on. But can you kindly introduce yourself?
Yes, how are you doing? My name is Dr. John
Amazing.
Sampson. I'm an anesthesiology and critical care physician at Johns Hopkins University, and I'm also the director of a global healthcare initiative that is bringing solar energy to healthcare facilities that are in great need of it in Africa, sustainable oxygen delivery systems to healthcare that need it, so that those healthcare systems can be strengthened to better take care of patients. My organization, which is the Institute of Global Perioperative Care and the Johns Hopkins GAP, those are the two organizations I work with. Those organizations are also training the biomedical technicians in how to maintain and sustain those things, as well as training physicians in how to deliver care in a way that best takes advantage of those new healthcare resources that are being established at those facilities.
Well, thank you very much for your time. We would actually move to the woman we are talking about, the chair for the fundraising committee, Mrs. To. Mrs. To, please, can you do a quick introduction of yourself for us?
Yes, Scarlett Pareto. I live in New York, US of A. I am a mental health therapist. Also am a behavior specialist consultant. I have an in-office school project of school supply. Currently I'm here for the fundraising committee for Canada Foundation.
Thank you so much for your time as well. So now we move to the CEO and founder of the Canada Afrique Foundation, Mr. Tamba. Mr. Tamba, please a quick introduction.
All right, thank you. I just again want to use this opportunity to say thank you so much, Charity, for hosting us. And thank you to Dr. Sampson and Mrs. Stowe. So again, Tamba A. Koko is my name, and I happens to be the CEO for Canada Afrique-Care Foundation. I'm a Liberian, currently residing in Canada, Montreal. So over the past 15 years, I've been an educator, I've been a social worker, I've been in the classroom for several years, lecturing in different senior courses in mental health, crisis intervention, psychology. I became, during the Ebola time, I became the first psychosocial counselor in Liberia through the UNDP. All right. So I've been grounded in those areas for a couple of years now. So emerging, coming back to Canada, I thought it wise to continue what I term as a passion, which is within my career. So I thought it wise to establish Canada Afrique-Care Foundation, providing the needs, services, and impactful society. So that's me. And yeah, thank you.
You're most welcome. So this very month, on the 17th of April to the 19th, we are going to actually have the official launch of this foundation. I would like to find out what actually are your expectations for this very launch. What are you putting together? Why should people be excited about it?
Okay. So first thing first is I expect to freshly open Canada Afrique-Care Foundation to the public, to the world at large, with no cost and no boundaries. No cost and no boundaries in terms of free services and across the globe. No cost, no boundary, and across the globe. So that's what I term as no cost and no boundaries. So the no cost, the Canada Afrique-Care Foundation, upon the launching on the 18th of April, of this month, we intend to open the corridor across the globe as we are. We have our 5-year strategic plan, which we are focusing on 100 individual categorically with focusing on nurses, social workers, academic counselors, community leaders, and the rest of them. So those categories of people will be focusing on upon the launching of Canada Afrique-Care Foundation on the 18th of April this year.
Okay.
Okay,
All right,
that sounds very exciting, Tamba. That sounds very exciting.
So we move to Dr. John Sampson. Dr. John Sampson, I think that your role is such a very big one. As a chief launcher, I mean, that's a very, very big role. In your opinion, how do you envision community development initiative in shaping the future, in healthcare? Because that is what you have actually been doing for the past years, decades, and being a chief launcher and also supporting this initiative. Can you please share some light on how you envision community development initiative in shaping the future of healthcare in Africa?
So I think that it's very important to have as much development, including community health development in Liberia and Sierra Leone as possible in terms of mental health. I've been working in Liberia since around probably first time going there about 1998. In Sierra Leone about 2010. And as most people know, both Liberia and Sierra Leone suffered extremely violent and prolonged civil wars that were actually synchronized with each other for political reasons. And as a result, there was a lot of violence and forced violence on children and adults across both countries. And a lot of people even have physical scars out of those who survived from both of those events. And many of the people who immigrated out of Liberia and out of Sierra Leone into Canada, the United States, immigrated because of the violence and trauma experienced from those two things. I can remember one time being in Sierra Leone in around 2011 when I actually met someone who was a board certified and experienced psychiatrist here in the United States, but of Sierra Leone descent. And I was very excited to meet him and was interested in what he was doing in Sierra Leone. He relayed to me that at that time, I don't know about now, but that's not too long ago. At that time, he said there were no psychiatrists in Sierra Leone. Though he wasn't planning to be one of them, he was actually going into politics. And so that really undergirded the huge need for increased mental health, counseling, treatment, identification of problems across both of those countries. And so I think this is an exciting initiative because it helps to address those issues of grave need.
Okay, thank you very much. We move to Mrs. To. Being as a specialist in mental health, can you kindly share your perspective on mental health and how important you think this very event is going to be for that?
Well, the importance for mental health, first of all, let me say it's a stigma and it's global. It's not one person or one country. Mental health is a serious issue in our today's world. How it's going to benefit CACFO, Canada Afrique-Care Foundation. We are going to train other people. We are going to train educators. We are going to train nurses. We are going to train social workers to go out there to the communities and engage them. That's one of the reasons why we have MOU with the Ministry of Health in various countries. So that way we can partner with them, collaborate with them, so that way they will be able to do the community engagement as we monitor and as we supervise. Now, as far as my specialist is concerned, I've dealt with people that have a lot of anxiety, depression, and so forth. So what we do some therapeutic sessions with them, and sometimes, depending on how chronic it is, they will need some medication to be able to help them sustain them.
Okay. Thank you very much. I go back to you, Mr. Tamba. In terms of the Africa-Canada collaboration, I think that many people would like to understand, in your view, what are the key benefits of the collaboration between Canada and Africa in terms of healthcare and community development?
So when it comes to health development, likewise, Canada and Africa, so we have a huge mental health gap within the space of 0.01% when it comes to mental health care gap in Canada. So we saw the need focusing on a few provinces within Canada that do have a huge mental health care gap. So we have some of those provinces. We have Manitoba, we have Nova Scotia, we have Alberta. So if you ask me again, what are some of the approaches that we're going to use that has to do with the link with the government of Canada? So we will be focusing on the health workers, social workers, academic counselors in their individual facilities, and they will provide us some of the areas. They will tell us their need. All right. Based on what they give us, we will be able to work with them. We will be able to support them because we have limited services. Right, we have public limited services when it comes to mental health in Canada. So those are things that subsequently, upon the launching of the foundation, we'll be focusing on that.
Okay, so there's a lot of anticipation built on the selection of your speakers, from Dr. John Sampson coming from the US, among other key achievers in their very fraternities. What actually went into the selection of these speakers?
Okay, thank you very much. So, looking at the background of passionate professionals, which is Dr. Sampson, looking at his track record, his experience, his professionalism, and also looking at those regions, geographical locations where he have worked. And we just underscore his passion and seeing the need that is very much important to have him on board so that during the official launch of Canada Afrique-Care Foundation, he can tell us more about those regions, those areas that he has visited, most importantly when it comes to public health. Because taking into consideration, if you look at our mission, the mission of CACFO is to contribute to global health in a comprehensive and impactful way, focusing on underserved communities across the globe, right?
Okay.
So, looking at Dr. Sampson's experience globally, he filled in that space. So we thought it wise to identify with Dr. Sampson so that he could tell us some of his experience and giving us the roadmap, telling us exactly what are those needs when it comes to public health in terms of mental health space globally.
Okay. So, Dr. Sampson, as the chief launcher, what are the strategies that you're implementing to ensure a successful launch of the foundation? What should we anticipate from you?
Well, as a launcher, what I plan on doing is just giving an inspiring presentation to open up the event and to help communicate what the objectives and the ambitions of the organization are.
Yeah, okay. So we would come to Mrs. To. I'm very, very excited that we do have a woman here. And if you take a look at some of the topics that we are going to focus on, you'll see we have gender-based violence prevention. Can you please share with us, as part of the organizers, why did you actually take a key interest in gender-based violence? You can share with us by sharing a story or your perspective. We would like to hear about that.
Gender-based violence is a human rights belief. It's a human rights issue. So it's very important. So as we know, in society today, people are not treated equally based on their gender. So we decided to include it and educate people for them to be aware of what is going on in today's society in the workplace. So I will give you an example. This man works in a place, and because of the way he looks, probably the way he talks, because of his appearance, dressing wise, the way he dresses, they seems to like outcast him at the working place. They seems to humiliate him somehow. Eventually, they fire him just because they felt something different about him. And these kind of things take place all the time, even with women as well. So that's why we need to bring awareness to these kind of issues that take place in workplaces.
Okay. Thank you very much. I'm very, very grateful
So-
to all of you for your time. Is there anything you'd like to add, Mr. Tamba, since you are the
Yeah.
founder?
Yes, so I just want to add that we have few other speakers across Canada and Africa. So of course we will be welcoming the former health minister of Liberia to the event, and we'll also be welcoming another senior educator, because if you look at some of our activities, it has to do with also educational capacity building program. So we have the president of Margibi University from Liberia. He will also be present. And during the event, we will have a panel discussion where we'll interact with a few stakeholders in mental health. We'll also be interacting with government officials. We'll also be interacting with senior educators, policy makers, where we will integrate into our vision and mission, making sure that upon the launching of Canada Afrique-Care Foundation, we can initiate our activities where it will not be limited only to a specific country or a group of persons. Taking into consideration, the entire program will be live. It will be live. All right. You can be all the way in Ghana as you are. You will be, you can log in and monitor the program from the beginning to the end. You can be any part of the world. All right. So we also we have our senior mental health care consultant from the West Island Mental Health Care Center in Canada. So we have a lot of partners that have identified with the foundation to making sure that, because they have seen the need, all right? They have seen the need. And everything that has to do with Canada Afrique-Care Foundation from the beginning, from scratch to the end, we do not have any grant. We do not have any financial support elsewhere. Everything comes from the officials, from their own pocket. That just to tell you that we are focused and we have passion towards mental health care initiative that will impact lives globally. Thank you.
Okay. Thank you very much. And what are your strategies in terms of education and cultural exchange? What countries are you targeting? Can you kindly take us through that?
So for now, right now, although it's no boundaries, geographically it's no boundary, but for now we have already identified with 2 different countries, including Canada, which is our base. We have Sierra Leone and we have Liberia division. All right. So we needed approach.
Okay. Thank you. Dr. Sampson, you have been doing very well in the US. You come to Africa. Now this is an event in Canada. If you could see one transformation emerge from this partnership in the next decade, what do you think that will be?
So, in the next decade, what I would like to see is for this to really focus on very specific targets of what they want to accomplish. I would like to see those specific targets be focused on the areas that they have identified a need for. And those areas are improve access to mental health treatment to the people affected by the Liberian and Sierra Leone Civil War. And so I think that that is a good starting point. And from that starting point, other things can emerge. But I think that identification of the key priorities and a deliberative focus on addressing those key priorities are key. So I hope that people will come and participate in the program.
Conference. It was such a great time being with you, Dr. Sampson, Mr. Tamba, and of course, a woman, I would say the she achiever in all of this for this very interview. I'm talking about Mrs. To. Thank you all so much. So viewers, it is still about the first global conference and official launch of the Canada Afrique-Care Foundation, which is going to happen on the 19th of April to the 19th of April 2026. That's a Friday to Sunday. Before we draw down the curtains, the founder, Mr. Tamba, is there any few words that you'd like to share with us? And we take one few words from each of you and then we draw down the curtains. So let's begin with you, Mr. Tamba.
Okay, thank you very much. So I just want to use this time again to encourage for whosoever that will be opportune to listen to this podcast. I want to encourage you that mental health is everyone's business. Mental health is a global situation that we all need to put our hands on the decks to making sure that we reduce the risks of suicide and all of that. So again, my number is 438 maybe inquiry or concern, and our website is www.cacfo.org. Again, our website is www.cacfo.org. Thank you.
Thank you very much. Mrs. To.
Yes. Again, I thank you for having us. We appreciate you welcoming us to this platform. If I were to say anything, I would just tell the audience that mental health is not something that we need to play with. It's a global issue. It has a stigma for us to care. Mental health is not something that you think, okay, it's gonna get away. You must do something about it. So that's what CACFO is for. That's what Canada Afrique-Care Foundation is all about, to train and bring awareness to mental health, to train people in the community, to train people in the schools, to train people in wherever society you might find yourself in. We just need people to partner with us so that way we can do better by our people. Thank you.
Thank you very much. Thanks very much, Dr. John Sampson.
Come join CACFO conference. Come to Montreal and participate. Thank you.
Thank you very much. As we draw down the curtains, this is a reminder for everyone listening to us. If somebody gets in touch to seek for help, just understand that it's not a sign of weakness, but it's a sign of strength. And so at this juncture, we would like to draw down the curtains for this session of a great interview with great personalities, great people doing so well in the globe. And it's all about the first global conference to launch the Canada Afrique-Care Foundation. This year's theme is Building the Future with Canada and Africa. Come to God, Canada. See you. It's a bye now.
Thank you. Bye-bye.